Hey, I'm Alexis, and I'll be demonstrating how to give an IM injection. So the first thing I'll do is verify my provider's orders with the MAR. So it's showing this patient is getting Haldol 4 milligrams IM for agitation. So our medication vial we have is Haldol, and it is 5 milligrams per milliliter. So she will be getting 0.8 milliliters. And I'll also check and make sure this is not expired, and it's not. Since I'll identify my patient, this is this patient. You will be getting Haldol today, 4 milligrams, which is 0.8 milliliters for agitation. Hand hygiene, and I'll put on my gloves. While I'm putting on my gloves, I will go ahead and state that if you're giving an IM injection, you want to give an IM injection either in her deltoid, in her vastus lateralis, or her ventrogluteal. And also for a size range, you'll give it's about 22 to 25 gauge and an inch to inch and a half long, and you give it a 90-degree angle. The first thing I'm going to do is clean my vial top. I will draw up 0.8 of air. I'll go ahead, insert it, and I'll draw up 0.8 of the medication, ensuring there's no air bubbles. Go ahead and pull this out. So in this case, I would normally do the lock to safely remove this needle, but for demonstration purposes and saving supplies, I'm going to safely pull this off. But in reality, you would not recap a needle. So I'll pull this off and put this in my sharps container. Then I'll put on a new needle. Okay, we're good. And since I'm in her room, I do not have to place a label on this, but if I was outside of her room preparing it, I would put a label on my syringe. So when I go in the patient, so I'm with my patient, check her name again, check the medication. She's getting Haldol 4 milligrams. This is what I have pulled up, 0.8 milliliters. This is for Miss Patient. We're going to be giving in her deltoid. Explain the procedure to her. It's going to be a little painful, but it should be over with soon. And I'm going to give it in your upper arm, okay? Take my alcohol pad. I'll clean the site. I'll take my needle off. I'm doing the V-track method. So I'm going to pull the skin, and I'll give her the injection like a dart. I will aspirate first, and I'll push the medication over at least 8 seconds since it's 0.8 milliliters. After that, I will go ahead and leave it in for 10 more seconds. After the 10 seconds, I will pull the needle out, lightly place alcohol pad on it. I will dispose of this in the biohazards. Then I'll go ahead, pull my gloves off, perform hand hygiene. I will document the procedure and how she tolerated everything.